doing a special thing today. Can you just sign on the dotted line?
Also critical, getting more African American men to take part in research. Not an easy feat after a long history of mistreatment.
If you're interested in research,
Dr. Monica Parker is the outreach director for the Emory Alzheimer's Disease Research Center. 2 years ago, they began these monthly minority men's health luncheons and discussions because African American men were the group least represented in research. African Americans are almost twice as likely to develop Alzheimer's disease, with 21% of people over 70 living with it. But only 2% of African Americans participate in Alzheimer's clinical trials. 58-year-old David Dorbin lost his mother to Alzheimer's disease. She was diagnosed in her early 60s. 81-year-old Joseph White is a retired biologist and pharmaceutical executive. Both men began attending the lunches, and both ended up enrolling in research.
I wanted to also get involved with research so that I can, number one, meet other people who were involved in research, and number two, get to know doctors who specialize in the care for people with dementia and Alzheimer's.
Different genders and races respond differently to treatment.
We want to make sure that anything that we develop with respect to a diagnostic tool, medical therapy, is as applicable to men or them as it is to anybody else.
I think one of the things that excites me is when you see 150 or so African American men who are interested in medical research as well as interested in their own health.
And while today is about science and research, this once-a-month program has created a community.
I speak to it, and seriously, as a fraternity, because as African American men, it's rare for us to, first of all, be involved in research, and secondly, to be highly recruited for research.
Almost 40% of men who've come to this event are now in research.
It's exciting.
Their participation could change the future, including their own.
To seek out us for research is absolutely awesome, and it should be more of this all throughout the United States.